We are injecting something or applying topicals to stimulate your body to produce what is missing.
A lot of Botox things and injectables really help with wrinkles, help with filling, but they're not really regenerating tissue.
The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Hello, this is Dr. Roy Kim with the Beauty Scientists, and today we're going to have a great topic on regenerative medicine with my co-host here, Dr. Kristy Hamilton. How are you doing?
Great, Roy. So good to be with you.
Great. So this is a very fascinating topic because it's newer, it's hotter. A lot of fillers in general just fill. A lot of Botox things and injectables really help with wrinkles, help with filling, but they're not really regenerating tissue. Kristy, what's your definition of like regenerative medicine, regenerative fillers, things like that?
So this is a very exciting new area of medicine because we are talking about regrowing your own tissue, so stimulating your own body to produce what's been lost. So we know that after age 25, for example, if we're looking at collagen, we start breaking down more collagen than we're producing. And so we go into this like slow deficit and usually doesn't show up until closer to 10 years afterwards. So that's why we have a lot of people in their 30s coming in noticing that their faces are starting to change. And then even more so for women after hitting menopause, as you taught me. But this is it. It's a different approach. Instead of directly replacing hyaluronic acid with a filler or doing fat transfer to replace the fat pads, we are injecting something or applying topicals to stimulate your body to produce what is missing or has been slowing down in terms of your body's production.
So the question is, can regenerative treatments, in your opinion, actually make tissue, skin, our appearance actually more youthful and regenerated?
That's what we're starting to see. So this is all early days, and you and I were always very careful to speak in like absolutes when we know we've got great data behind it. This is definitely, it's early days in the field, but I've been very impressed with the use of regenerative medicine myself in my practice. I've seen changes in my own skin, in my patient's skin. And if we look at the fundamentals of what these, and there's different kinds that we're going to talk about, but what they do, it makes sense that it would help to renew, rejuvenate. And it's a step towards anti-aging medicine. And that's a topic for another day. But that's what we're trying to do. We're trying to get our cells to function more efficiently. And we're trying to get them to work as well as they used to when they were the cells of a baby or the cells of a very young person.
Yeah, this is very exciting technology and news because it's truly regenerating. So there are a couple categories, including your own tissue, not your own tissue, but still biologic. Finally, not your own tissue and non-biologic. First off, your own tissue. What do you think about stem cells and regenerative medicine?
So stem cells were considered the ultimate for a very long time, but they're also very controversial and there's a lot of laws surrounding them. So there were products being developed to try to stimulate growth of like healthy new skin. I mean, would be great in surgery, right? Where we're dealing with scar tissue or wound healing, but they're bogged down in legal issues associated with like women's health issues. And so that stem cells, I don't think are going to be the future, at least in the United States, maybe in other countries, but stem cells they're used to promote the regeneration of cells, repair damaged cells, reduce the signs of aging, and you can derive them from your own body. So we do employ these principles when we're doing like fat grafting, for example. So we know that the highest concentrations of stem cells in fat come from the inner thighs and the lower abdomen. So that's where I commonly like to take fat to transfer to the face, for example. And patients will notice not only an improvement in the volume loss, but also oftentimes will note that their skin also looks nicer. And that we're assigning to an effect caused by the transfer of the fat, specifically with the stem cells.
Yeah. And so for the consumers out there, stem cells are what I like to call great-great-grandfather cells. If you give them the right environment, the right recipe, the right chemicals, a stem cell can turn into a skin cell, muscle cell, cartilage cell, whatever. That's why it's so powerful and cool. But as Dr. Hamilton has noticed, it's not quite the wonderful benefit that we thought of. And as plastic surgeons, we actually have awesome access to it because a high concentration of stem cells are found in our own fat. And another natural substance is PRP. So what do you think about platelet-rich plasma, something from our blood, as a regenerative filler regenerative agent in patients?
So that's a great autologous tissue too. So this we get from a blood draw from the patient, spin it down so that we separate the blood into layers and we target the platelet-rich plasma. And we know that this is a layer of the blood that is rich in growth factors. And that helps rejuvenate the skin by promoting collagen production, improving skin elasticity, and reducing the appearance of wrinkles. So again, a source of ongoing study, but increasingly we're seeing more and more use for these. So we enjoy it for hair regeneration. It's funny, I've been doing PRP for a couple of years now. And when I look back to what my hair looked like following COVID in 2020 and the way it looks now, I mean, it's like it's undeniable how much better my hair has gotten. I had extensions at one point. Now I don't need them. So I've personally enjoyed the benefits of PRP, and that's a great option, especially for patients who they don't want to go the filler approach. They really want to be more like truly natural. And I say that in quotes, but this is like as natural as it gets. It's harvesting the power of your own tissues just in a concentrated fashion and then injecting or applying them to skin that has been injured in a controlled fashion, like with microneedling or a laser.
Yeah, I think PRP is great, and it is the patient's own blood. Getting to other biologicals, these are not autogenous yet. They're not derived from yourself, but exosomes are a very hot topic. What are they, and then how do you use them in your own practice?
So exosomes, they are cellular components. So these are tiny vesicles. They look like little sacs with a little membrane around them. And they are produced by cells in your body and my body. They act as messengers. So these are nano-sized particles, which is great because it means that they penetrate tissue really, really well. And they carry not only growth factors, like we were talking about with the PRP, but proteins, lipids, RNA. And this is how cells communicate with each other. So it makes sense that you could choose exosomes that are going to stimulate production of collagen or elastin in the skin and beyond. There's so much more. Like those are the like hot topics and keywords. We're always thinking about collagen and elastin, but there's so many more components to promoting healthy skin. And since these are coming from living tissues, humans, we know that we can enhance cell communication, and this is crucial for skin repair and regeneration. It's also great in our plastic surgery practices, applying them to scars or incisions that are healing, and that accelerates the natural healing processes of the skin. And finally, when we look at anti-aging, they reduce inflammation, can produce collagen production, and encourage the rejuvenation of skin cells. And all of those contribute to a more youthful appearance.
So interestingly, the FDA has not approved use in the US with human exosomes in patients. So the exosomes that you use must come from another source, correct?
So I'm exploring a variety of different sources. I don't want to talk about specific companies right now, but there are ones that are sterile and therefore injection grade, and others that are more for like topical application. And they're increasingly part of some of our topical skincare products. So one that I like comes out of two physicians' research at the Mayo Clinic. So, and they deal with like billions of exosomes in these little vials. So it's very exciting.
Yeah, it's pretty wild. I've seen the product that you're talking about where it's a literal vial, and yet there's tons of exosomes inside that we can use for a patient. Kudos to you for doing more research on it. I'm going to have to talk to you later about what you like and what you don't like.
Yeah, it's just at the beginning. And so it's exciting to see what this can do. But I will send you some. Go apply to your face and glow.
That's great. And then I'll look as good as you with more hair and better skin. It's going to be awesome.
We can all use more hair and better skin.
That's right. The next up is tissue scaffolding. So we've used this in surgery. We've talked about this briefly in the past. In terms of, not patient derived from a single individual patient, this regenerative tissue, how have you used it in your own practice?
So this was more overall born out of our days doing mainly reconstructive plastic surgery, but we've been using scaffolds and matrices, biocompatible ones. So ones where basically we have biologic tissues that allow tissue ingrowth. So what do I mean by that? It could be a collagen scaffold that all the DNA has been washed away and then you grow back your own cells into that. And ultimately that then becomes your own tissue. So this we commonly use in breast reconstruction. I know you and I have done countless cases with those materials. They've been used for abdominal wall reconstruction, meaning treating really complex hernias and getting everything back into place. So that is ultimately another aspect of regenerative medicine. We're giving the tissues somewhere to grow into, and then ultimately it becomes your own. So it's different than applying a serum or injecting a sterile solution. This is literally a matrix or a scaffold that's allowing your tissue to regenerate. And then where do we go from here? Well, wouldn't it be wonderful if one day we were growing new fingers or growing breast tissue or growing like true organs to utilize? We've also used those type of matrices in wound healing, like ulcers, burn skin, and those have been shown to work well too. I think you and I did tons of those in residency.
Yes. So, excuse me, this is commonly used in breast reconstruction, aesthetic breast, creating the eternal bra. We have a separate YouTube podcast about that. And increasingly, I mean, people have used it actually for neck lift augmentation, and there are going to be some other applications in the near future. So that's going to be a lot of fun.
Yeah, that's great. It gives you some structural support, but then also like regenerates and turns into your own, because we've seen so many issues with those permanent plastic meshes putting into your body. So this therefore becomes something that's truly a part of yourself.
Yes, and that's the very, very cool technology. We don't have truly regenerative facial fillers yet. They have them out in other countries. We talked about the filler derived from salmon sperm DNA, which actually regenerates collagen and we think some overall underneath the skin dermis. Now, we also, in the US, we do have non-biological sort of biostimulatory boosters, including Radius and Sculptra, different chemicals from the common fillers. What has your experience been with Radius, which is calcium hydroxyapatite, or Sculptra, which is, what is it? PLA.
PLA, polylactic acid.
That's right.
Both collagen stimulators. Radius stimulates two types of collagen as well as some elastin. And I think these products work well. I, as someone who does facelifts, try to be more conservative with them in the face because, you know, what is collagen? Scar is collagen. Collagen is scar in some forms. And so it can create kind of like a stickiness on the outside of the face. So I prefer it more in the central area where I'm like less likely to be raising tissue. I especially love those products for body contouring, adding some volume for hip dips, a little like prickiness to the buttocks. So anywhere where you want some like smoothing and conservative plumping. And I know those aren't areas I go into with cutting anyways for surgery. Like it's right into the center of the buttocks. So I don't worry about having some stickiness to the tissues there. Where do you like to use them?
I like to use them very conservatively in the face. I don't love just using it alone like you for the body. I like to mix it actually, if possible, with fat grafting, and then that's a good combo. So you have sort of instant gratification as well as hopefully some long-term collagen ingrowth into the areas of hip dip, into the buttocks, things like that. I don't know how you use it or if you use it in a similar fashion.
Well, you're always going to get definitely more dramatic results with surgery, and you just have more material, much more cost-effective way too. But for patients who like aren't interested in pursuing surgery, I think it's a great option for like conservative enhancement, specifically like for hip dips or smaller areas, and really nice for overall smoothing. So even for someone who has had a BBL or fat transfer, this could be like a great kind of like cherry on top to go in and just like add some like smoothing to the like residual cellulite that may be there, and just like really, really enhance skin quality as well.
Yeah, and it does last a very long time. And the hope, of course, is that the collagen will last there longer than the actual product. So finally, there are some outside things that we can do for regenerative medicine. What is your take on things like IV therapy, hyperbaric or extra oxygen, even a better diet in terms of your ability to get patients the best result from really enhancing anything that's regenerative?
Well, we know hyperbaric, that's got a great body of evidence behind it. We know hyperbaric oxygen, or going in those pressure containers, really helps improve circulation, helps with tissues that might be a little bit distressed after surgery, and promotes healing. So we've seen tissues from injuries or surgical or otherwise, whether traumatic or not, go in and then just because they get so much more perfusion, oxygen, nutrients, tissues that may have not survived do survive, and it promotes healing. So I actually really love sending patients for hyperbaric, specifically after facelifts, just to expedite their healing, but it could be great for anybody that has a surgical or traumatic wound. And then I'm also a really, really big proponent of increasing protein. So I asked my patients, like an average size patient, to increase their protein intake to 100 grams a day leading up to surgery and following surgery. And I think that has really made a big difference too. And there's a big body of medicine behind increasing protein in your diet for just like longevity, better life, and wound healing.
I totally agree. And then regarding IV therapy, assuming that my patients are able to eat and consume vitamins and supplements, I don't think that IV therapy is as beneficial right after surgery or right after a regenerative procedure to get them the best results. I don't know what your opinion is.
Yeah, I think if someone's not drinking, they're not consuming what they need to be, then it's a way to get some truly like saline into them. If they're not urinating enough, then that can be helpful. But assuming patients are feeling well, they're not nauseous, then they should be able to consume enough electrolytes and enough fluids on their own. But it's a good option for those that are struggling to do so for any variety of reasons.
Well, that just about does it in terms of the current existing regenerative mechanisms, the various procedures we could do, the actual materials, including exosomes, tissues, PRP, stem cells, and other things. If you have anything else that you wanted us to talk about for the people out there who have questions, please fire away below us and ask us any questions. And Dr. Hamilton, did you have anything else to add to the wonderful world of regenerative fillers and regenerative medicine?
Just that we have to keep an eye on this. So it's going to be moving quickly. We're going to be building the airplane as we're flying it. And it's a really exciting new frontier of medicine, and I'm here for it.
Yeah, well, for all of those out there, thanks for watching. Thanks so much for listening. And Dr. Hamilton, as always, and to our viewers, stay beautiful.
Stay beautiful.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.